campus master plans to create well-being in our settings, communities, and individuals.
Yeah, that's amazing.
Some folks are not on mute, so if you can go on mute when you're not speaking, that would be great. Thank you. Okay, so I'll jump into my portion of the presentation, why being a health promoting campus matters. And I just wanted to start by saying that this is really a global movement. Health promoting campuses are flourishing, established. The UK and Germany, for example, have had health promoting campuses networks for over a decade. And I'll talk a little bit more about Canada's in a moment. But I thought I'd first talk about what makes universities, colleges, technical institutes unique as settings to act as agents for change. And there's some things that we do that are quite unique. First, we teach and we do research. That's one of our primary mandates. What we're not always aware of is that we're owner-occupied with significant building stock and operations. At UBC, for example, we have over 400 buildings, 1,000 hectares of land, and a budget of over $2.3 billion. So that allows us some unique opportunity around influencing our campus settings. We're also public institutions with a public mandate to create new knowledge for community benefit. We can plan over long time horizons. We are here for the long term, and that allows us to be quite aspirational and long range with our planning. And finally, a little bit more tied to student health side of things, we're places where students undergo life transition. They're experimenting, developing life skills, and facing particular health challenges. Cerebral cortex doesn't form fully until 25, which means that they're still in a mode of transition where behaviors are still being formed. So the Okanagan Charter, I'll just introduce briefly now, as a guiding document that builds on the work of the Ottawa Charter that framed as health promotion, but translates it into a campus context, a campus setting context. The Charter was created, and I'm sure most of you are familiar with it by now, but it was created in 2015 when we had an international conference that brought people from 45 countries together and over 80 universities, as well as the World Health Organization and UNESCO. And over an 8-month process that culminated in an intensive discussion at the conference, the Okanagan Charter was created. And it essentially provides common language and framework for what we mean by health and well-being promotion on a campus setting. This is the vision of the Charter: health promoting universities and colleges transform the health and sustainability of our current and future societies, strengthen communities, contribute to the well-being of people, places, and planet. And I just want to underline that the connection to the planet is critical as well. So this really outlines the need for thinking about sustainability as well. We can't be healthy without considering the environment, and if you think about climate change, it may already be the biggest contributor to healthcare costs and mental health concerns. I mean, if you think about air quality impacts in China, or if you think about the anxiety and hopelessness that happens around natural disasters, that's the connection that we need to stress. There are two broad calls to action in the Charter. The first one is about everything that we do on our campuses. How do we embed health into all aspects of our campus culture across the administration and the academic mandate, as well as our operations? And the second one is the idea of leading health promotion and action in collaboration locally and globally, working with broader society. The Charter has 8 key principles which are very powerful in guiding how we go about doing our work. I won't go through them all in detail, but the 3 of us will reference these as we go through. At UBC, we refer back to these principles in everything that we do and how we design our strategies, our plans. They're important to consider how they guide our work. I'll just touch on the first one, which is the need to use a settings-based and whole systems approach, and talk a little bit more about that, because an important shift in this work is shifting from an individual behavior focus to more of a system and settings-based view on things. So I just thought I'd share a nice metaphor to give you a sense of that. This came from Dan Rice, who works at CSER. If the frogs in the pond started behaving strangely, our first reaction would not be to punish them or even treat them. Instinctively, we'd wonder what was going on in the pond. which I think is a lovely way to illustrate the shift that we need to make from focusing on just treating individuals or focusing just on health services, but think about the whole environment and the settings around them, where we work, learn, live, and teach and do research. So we should really be asking ourselves, are we putting enough focus and resources into the broader settings-based approach? So following the creation of the Charter, Canada formed the Canadian Health Promoting Campuses Network as a way for campuses across the country to collaborate and advance the movement around the Charter and supporting universities that are on the journey to become health and well-being promoting. The website is there at the bottom, so I'd encourage everyone to go have a look at what we're all about. In essence, we work to share best practices around strategic implementation and initiatives in this area. A quick example I just wanted to highlight is we've been supporting the creation of a new Canadian campus well-being survey tool that will create a 20-minute module for campuses across the country to use to evaluate health and well-being of students, staff, and faculty. It's being piloted in BC right now, but the goal is by next fall to open it up to the rest of the country. And there's a website that you can look at, but it's a great example of collaboration around an effective tool that would support our work with some strong evaluation. And then one of the other things that the network supports is formal adoption process for the Okanagan Charter. So as of about a month ago, 20 campuses across the country have formally adopted the Charter, and that means that a university leader, typically a president, has signed on to a document to say that they formally adopt the Charter and make some public commitments around driving the work forward. And we also have 5 organizations that have endorsed the Charter, including Caucus and the Canadian Mental Health Association and NERSA, and they play a strong role in providing capacity and resources to campuses to support them doing this work. So the momentum has really been building both in Canada and across the world. And then it's just a shift to what some of the institutions are doing. I'll talk about UBC, and then you'll hear about some examples happening elsewhere from my colleagues. It's important maybe to give you a bit of context around UBC before jumping into specifics. We are quite unique in terms of our size and scope. We have over 60,000 students on our 2 campuses. We have the Vancouver campus, which is pictured top left, which sits on the traditional ancestral and unceded territory of the Musqueam people. We have 1,000 acres of land surrounded by gorgeous forests and beaches. And then our Okanagan campus, which incidentally is where the Okanagan Charter was created, which is why it's named that way, is located in Kelowna on 500 acres of traditional unceded territory of Okanagan Nation. So this summer, UBC formalized a strategic framework which takes the commitments and guidance from the Charter and translates it into what UBC will work to do. We set ourselves a commitment to becoming a health and well-being promoting university and have a series of targets, 2025 targets in 6 priority areas. And I just want to show this diagram to give a sense of our approach, which is really about taking a systems lens and a whole organization approach. This doesn't work in a silo. We need to think about how the whole university can drive things forward. In the center, we're showing that this is about our whole community, our students, staff, faculty, and broader community. We have 20,000 community members that live on university lands alone. We then are tied in with the university strategic plan. This is named as a priority in our new strategic plan at UBC. And then the outer range shows our 6 priority areas of action. So following consultation with our community over many years, we've come up with these 6, which are mental health resilience, food nutrition, social connection, built in natural environments, physical activity, and then collaborative leadership. And I'll just give 2 quick examples of 2 of those. I'm actually quite excited about our recently added priority area around collaborative leadership. We recognize that leadership has to happen both at the senior level as well as creating space for it to emerge from the ground up. We have 2 targets here. One is that we'll evaluate how community members feel UBC is committed to the well-being of people, places, and community through some surveys that we run. And the second target is getting all faculties and units at the university to include well-being in their plans and report on progress annually. And so the goal here is to shift from, to really make the whole organization. The picture is showing a recent leadership workshop we did where we had 150 leaders from across our campus come together, and we talked about shifting from individual actions to organizational or portfolio level actions, and to shifting from a reactive approach to a proactive approach by embedding it in priorities and planning. Since we're talking settings, we decided to not pick some of the usual suspects in terms of where we apply this work and talk about mental health or physical activity. We do a lot of that work at UBC, but I thought I'd pick something a little bit different to stretch our thinking in this area. So one of the areas where UBC does a lot of work is in designing our buildings and spaces. We have 500 buildings at UBC, and we recently launched an extremely ambitious green building action plan. And it ties in with our sustainability objective as well to say that UBC's buildings need to achieve net positive contributions to human and natural systems. And at UBC we talk about aiming for net positives with the view that we shouldn't just be talking about harm reduction and doing less bad. We really need to shift it to a much more ambitious commitment to be net positive, whether we're talking energy, climate change, or on the human side. Could people be supported to leave university more equipped and resilient when they arrive? So what's unique about this plan is we actually have health and well-being as one of the 8 pillars that has to be considered in the design of all of our buildings going forward, which is the unique opportunity to drive things forward. And at UBC, we frame things, it's similar actually to the call to action of the Charter in 2 ways. One is thinking ourselves as the campus as a living lab. How can we test, try, learn, and then share results of initiatives like this across on our campus and then be an agent of change for broader society? Actually, I forgot to say that the picture here is of the tallest wood building in the world, which was built at UBC as a student residence, the largest mass timber building in the world. And this building here is the Center for Interactive Research on Sustainability, where I'm actually sitting right now, which is designed as a net positive building in terms of energy, water, and climate change, but also on the human side in terms of health, productivity, and happiness. So it hasn't achieved it in all areas, but has set that intention and has research ongoing to try and achieve that. And my final slide here is, again, the idea that we have been on this track with our buildings towards designing more sustainable and now more healthy buildings for a number of years. And this is a chart showing broadly the idea of continuous improvement with the goal of reaching achieving net positive in 2050, which aligns with our climate neutral goals by 2050. The Charter happened in 2015, and that has already informed the design of some of our new buildings. So we hope that this will really drive things forward and think about our buildings as important settings that will influence everybody on our campus. So I'm now going to pass it over to Dennis, who will talk a little bit more about campus master plans. Over to you, Dennis.
Great. Thank you, Matt. So the learning goal here is really how we begin to bring programmatic efforts on campuses and the physical environment together. And then as bringing back the principles for the Okanagan Charter, there are a lot of these principles that really do relate back to what we do as campus planners on the campus. Most all of them, but particularly the settings approach and a whole systems approach is something that we do we do quite often. And then the other piece is that what we do as architects and designers is really well researched and understood that the environment can predict and affect how we feel in an environment. And then the other one is just the notion that there are these spaces on campus that we have created that learning can happen. Here in this case, learning about well-being can happen outside of the classroom. So a systematic approach to planning for well-being really starts with understanding the background.
Hey Dennis, just real quick, would you mind turning on your webcam? People people are saying that they can't see you.
I'm sorry, I don't have one.
Oh, you don't have one. All right then. No worries.
Yes, I apologize. The program, program identification, and then implementing the program and doing and working through the phases. So why do we plan? And in most institutions, there is a comprehensive physical master plan. And I just want to quickly go over why, what, and how, and who, and the results of doing this physical master plan are on a campus, and how it fits very well with creating a campus for well-being. So why? Most of the time, a campus master plan is created to match the facilities with the mission of the institution. It's to guide investments, and it's also to accomplish certain goals. So creating an environment for well-being is something that fits in very well with creating the physical environment as you begin to think about the future in the campus master plan. This is the United Nations goals for sustainable development that we use quite often as we plan college campuses. And number 3 is certainly is certainly the one we're talking about and focusing on today, but to be honest, sometimes does not get as much attention as others as we go through the comprehensive planning process. But the plan itself really helps you guide the largest investments in expenditure on your campus physical, the physical part of the campus. And it also sets a policy in terms of how you begin to match financial, programmatic, and academic goals to the facilities. And here again, if we were to begin to think about, is there a way to do a campus master plan for well-being, can it be incorporated into the current master plan that you have, or is it something that you can add in and do a separate plan for well-being? But as you plan, usually there's the governance at the campus that leads and directs the campus master planning, and guided and really managed by the campus planning department. The who on your community is everybody. Everybody should be involved in creating the campus master plan, particularly if it's about well-being. The process is always and should be quite transparent, and this comes right out of the Okanagan Charter principles to ensure comprehensive system-wide approach and bring in all of the voices, and then also acknowledge the indigenous communities that were there before and their context and their priorities. So one of the small examples I have in terms of a set of institutions that wanted to create, really started out as a placemaking master plan for an urban environment, but it really did turn out to be more of a plan for promoting well-being for their campuses. We started with just looking at the systems, like as the first step. So these are the spaces in this urban environment in Boston, and it begins to identify the characteristics of the spaces. Here is the exposure, the sun exposure at noon, and then we looked at where the pedestrians, walk, and the volumes, and how they're getting to the campuses. So as we begin to think about where we want to put well-being programming, we're able to find where we're going to get the most foot traffic. This is an example of where the employees work. So this is the density, and there's 30,000 employees that work in this neighborhood, and we were trying to put our programming in places that would come and be most accessible to the bigger amount of people, the most amount of people. Part of well-being and happiness certainly is noise, so we mapped where the noise was coming from as a characteristic. We had stakeholder interviews in terms of what types of programming to come out for well-being and taking a break from their jobs they wanted to have happen. And then our first phase was to bring out programming over the summer that in these spaces that are here in red. This is just a quick example of how spaces can begin to be more conducive to well-being. And this is a small step. There's a lot of other things in terms of creating a master plan for well-being, but one of the big advances here was to bring out the umbrellas and provide shade and comfort and the movable chairs. But there was also programming that came in also that was supported in these plazas. So to wrap my section up, I really like to talk about building campus, and I've on the left here show some research that has been done in terms of how nature really begins to, number one, the first one is help patients heal. The second one was work on how being able to see out a window at work begins to lower blood pressure and increase your productivity. And then the third one here is it was a study in an urban environment where students were coming to their classes from an environment that had a lot of trees, and then students that were coming to their classes from an environment that did not have a lot of green space. And the students that were coming from an environment with a lot of green space had superior working memory over time. And then the last two is the fact that trees and green space and having a campus is actually good for our life expectancy and our earning capacity. And then the last one is the restorative benefits of being able to just go outside and have an opportunity to be with the trees and to be on the campus. This is not to say that there isn't a lot of other things that happen for well-being, but in terms of a first step that a lot of campuses can take, they can begin to match the assets they have in their physical environment with programming that they have around well-being, and bringing that match together will support both of those further. So Paula, I'm going to hand it off to you. Paula?
Thanks, Dennis.
Okay.
I'm here. So hello, everyone. My last position here is to speak a little bit about advocating for collective impact frameworks, policy, and campus master plans to create well-being in settings, communities, and individuals, or person, place, and planet. That is Han Plaza in the middle of the University of Southern California. I have been here 3 decades and can tell you that that fountain has changed the livelihood, the feel, the desirability of that particular space on campus. Prior to about 10 years ago, it was an inverted fountain. It was lovely, but it was very quiet, and people kind of forgot it was there. So I'm going to move fairly quickly because I want to make sure we have time for questions. And here we go. For those of you who know me, there's always a bit of a history lesson. The history lesson here is about 100 years ago, we had a huge innovation in what was called college health, or might today be called creating a health-promoting campus. College health at the time went through this revolution because of the credibility of medicine. The idea of germ theory, contagion, John Snow, and water pumps. So it's documented that at the turn of the century, almost no one had a physician on campus, or maybe one. And by 1934, no major schools had were without a separate health service or the local healthcare clinic that we think of now. The history of psychological services also being provided on a campus is somewhat parallel to this, but it has its unique history. But that was the last innovation, and today we're talking about the next innovation. Next, the groundwork for this innovation of the Okanagan Charter was started in 1986 with the Ottawa Charter, also from the World Health Organization. What was clear at that point in time to that organization is that we would never get to health through healthcare. Healthcare can help a great deal for an individual or a particular group of humans, but in fact there's this other process called health promotion, and there are fundamental conditions that are required for health of a human being or well-being of a planet, and that is peace, shelter, education, food, income, stable socioeconomic systems, sustainable resources, and then this last one, which makes my heart sing, which is the idea of social justice and equity. That was in 1986. In that document, we talk about what health promotion is and where health is created. And I think it's important for us to step back and think about the idea that health promotion is really focusing beyond an individual's behavior and towards a wider range of social and environmental interventions. So it's that shift that Matt spoke about earlier, from looking at everything with a biobehavioral hammer, that I could just change chemistry or change someone's behaviors, I could get them to be healthy, to more of a systems or setting and environmental perspective. And I think it's powerful evidence, if you look at those citations that Dennis provided, the idea that cognitive development comes quicker for children who are living in green spaces. And it has, I believe from the reading I've done, it has something to do with the fractals that are around us and what those fractals do to the neurological connections in the fibers of our bodies. So this is the next innovation on our campus. And to help people who are more visual, I'm working on this. I haven't written about it yet, but we call it the snail. It's moving beyond what we think of as healthcare. That red line that's maybe hard to see is a point of diagnosis or an event, a car accident or, God forbid, a sexual assault, understanding that you have diabetes or something along that line. But moving out to the left and moving further out to the left, because many of us are quite comfortable with what gets called in the States quite often prevention education, this idea of developing personal skills, which is one of the 5 health promotion actions, but it's not nearly as powerful, or shall we say, it needs other factors to be in place, and that's the policies and the settings. So how do we actually create this? How do we get to the infrastructure questions? Well, the infrastructure questions really relate to the number 5 of these principles, developing interdisciplinary collaborations and cross-sectional partnerships. Many of us have tried this for decades, and just recently at the University of Southern California, we made a major shift to look at what is needed for effective community development, for effective cross-sector partnerships, for effective interdisciplinary collaboration. And this is what we came up with. Collective impact. Some of you may be familiar with this. It's quite, it's used a great deal in the nonprofit world, where you have a government, a nonprofit agency, and maybe a local business owner or corporation trying to get to a shared end or a common agenda. And it is an interesting piece of research. If you go back and read the original, it caused quite a stir, because the research is really nothing new. It was looking at where things were effective. So if you had these things, what was required for it to work in from a community development model, what needed to be in place. And it came up with 5 conditions that need to be in place. I'm going to speak briefly to 3 of these. the backbone, the common agenda, and the shared measurement. I'm happy to spend more time at another time talking about what mutually reinforcing activities and open communication looks like. But let me start first with where I live, which is about almost a year ago. My department, which was, I think at the time, Wellness and Health Promotion, it had been a health education department. It was predominantly doing health education, helping people doing service delivery for personal skills development. I like to think that I had some say in policy, and I've always been a bit of a data geek, so I always had more data than anybody wanted to pay attention to. But a year ago, we got to become the backbone organization for the USC Wellbeing Collective. And a backbone is the glue. The backbone keeps record of what's going on, holds data, communicates constantly, shares best practices to keep all of our participating organizations moving along in the direction they want to move along in. Note here that it is dedicated, separate staff. We are not a participating organization itself. So while I organizationally reside within the Student Health Center, my director, Dr. Sarah Van Orman, we articulate to the Student Health Center as a participating organization, and that includes our counseling services as well. And other participating organizations are Student Affairs, our Hospitality Service, our Sustainability Office. Anyway, Campus Police, I don't want to get too far afield on this, but I can speak more about this in another time. So I'm speaking as the head of the backbone organization for our collective. What is our common goal? It took us about 3 years to get this. It was part of a very serious strategic planning process. And our common goal, our common agenda, is strengthening a culture driven by student well-being. And what that looks like for us as we spoke that through so that we can make it measurable is having equity and inclusion, having individuals and communities thrive, disrupting our culture of at-risk substance use, and fostering consent and healthy relationships. You might ask, how will we know when we get there? We have set KPIs. Our KPIs currently are these 8 items, and our targeted goals look like that. So this is not pie in the sky. This is very specific, moving the needle. What does moving the needle look like? That doesn't necessarily look like more programs or more staff. It's a lot about how you do what you do, where you do it. So how you fund different things. What money is going where? How much are you spending where? Who and what are the narratives? What are the stories you're telling about your place? What's the predominant narrative about why people come to your place? Really looking hard at the dominant cultures and whether or not other cultures can exist. We are looking very deeply at how overwhelming our football culture is for a freshman who comes here, first-year students, within the first couple weeks, and whether or not you can actually not like football. And what does that mean for you? Can you go to a practice room and play piano? Well, right now you can't because everything on the campus is locked down. So if you need to play piano on a football Saturday, too bad for you. So policy and then the built environment. This is what alignment looks like, and this is what this question looks like of what do you do? A bit of history so you get a sense. Dr. Ainsley Carey was our VP of Student Affairs. He came in wanting to do student affairs very differently. He wanted to move it, although it will still always be about people learning in their living environments and getting involved in student activities. It will still also be some of the crisis, individual counseling, management, clinical, if I do say one-on-one kind of work. He really wanted to take a systemic approach. I think that came from his MBA. And then we started looking at how to reorient student affairs. Student affairs is separate from the student health centers. Health center is part of tech medicine, and we became the founding partners, student affairs and student health. And now there are 23 participating organizations. A bit of history. I'm going to stop here so that we've got a full 20 minutes for questions. And just read you this, which I think is a guiding principle. Matt uses this slide. He let me use it today. Let us find a way to belong to this time and place together. Our future and the future of all our children rests with the kind of relationships we build today. Chief Robert Joseph. So on that note, I'm going to start questions and I'm going to answer one, and then I'm going to kick it back to Matt because I think Matt had an answer. In the chat notes, I've answered one question that said, that asked about CAS, the Council for the Advancement of Standards in Higher Education. And my chat note is that there is, someone said, is there duplication? And CAS, Healthy Campus, BHAC, 20 by 30, there are many things that are happening here in the States that are all what I would call magnifications. But the guiding principle that I see in all of these things is how we go about becoming a health promoting campus. And the Okanagan Charter is the North Star of that. For me, that is, it speaks in very eloquently, very quickly to what we want to be through all these different processes. So on that note, I'll turn it back over to Matt if he wants to answer the question about infrastructure.
Thanks, Paula. Yeah, so Jennifer had asked about how did we shift from transition to implementation. I mean, yeah, so I'm happy to chat about that. We've spent some time on the wellbeing.ubc.ca website mapping out how we're actually structured, and I talk with a lot of campuses about that. You know, so I was just thinking about that. I think some of the key elements are make sure that you get buy-in from senior leadership in multiple places, not just one place. The goal here is really to be whole university system-wide, and so you need broad-based support to do that, and you need to build coalitions at multiple levels that want to achieve that. So the way we did that was create a dedicated team that we call Strategic Support Team. Paula's approach is very similar. She talked about collective impact and creating a backbone organization. We act the same way. Our team acts like a backbone organization to support the whole university, support our VP Students portfolio, our VPHR portfolio, our campus planning portfolio, our academic faculties, to support their work. So it's really critical that you have identified people and resources that can support that broad work. And then we also create a number of committees to drive our action areas, we have action teams, and those committees again are made of student, staff, and faculty that bring a whole organization lens. So there's no one way to do that, but I think it's critical that there's dedicated time and resources given to the how. And then the final thing is just have lots of conversations, lots of engagement. People love this topic. They want to lean in. You get some really talented people doing this work. And so just pop up tents and create a conversation around the charter, and I think you'll see great things will happen. Paula, do you want to jump in on that too? Because I know that there's a lot of parallel to how USC is supporting the work.
Yes, I think I echo everything you say. The piece that I think is most important is creating something that is not a service delivery unit, something that can focus directly on the systems work. And that's hard in this day and age because we want to find out whether or not it's insurance reimbursable, or whether or not, you know, how many widgets we've created, or how much this we've done, or how many visits, or how many people, or that kind of thing. And so the backbone piece that we were really grateful for was this idea that you need to pay attention to process. And you've got to have somebody there who is convening people, oh my goodness, bringing people together, creating some level of consensus, making sure that the key indicators, the key performance indicators, that shopping those around. We went through, I don't know, maybe it's only been a year, so I think most of the beginning of this year we kept going, is this the right measure for that? Is that the right measure for that? We're still not happy with our KPIs. There are no settings indicators in there, and I'm woefully bemoaning. I mean, we use Healthy Campus. Excuse me, Healthy Minds, the Healthy Minds survey. We've used some ACHA, NCHA data in the past. We have. We are looking at the Canadian survey. The Wake Forest has got a survey. Nobody really has the market on the best survey or the best surveillance tool. We're going to create our own for some specific things we want to look at. But I would say regardless of what data you're using, eventually creating consensus is a big part of my job, which is funny for those of you who know me, because generally I like to stir things up and cause people to not necessarily consent. But we are working a great deal in that area. So I think that answers some of that question, Matt. I'm curious, I want to ask Dennis, is there any question, any thought about where campuses are with well-being master plans?
I think many of them are just getting started. I was just out at University of Albany last week and bringing together their programming around well-being and their new programming that their well-being is doing, and their physical campus planning department, where they hadn't really had the opportunity to discuss how important the physical environment is to well-being, and at the same time how it can help support their programming. So we left thinking that they may start a pop-up program on a pop-up event around well-being around campus, and begin to pilot that in several different places on their campus, while they begin to enhance the environment through physical improvement, but also make sure that there is a match with what kind of programs they're going to come in and use within that space. So there are very few campuses that have really started to incorporate well-being in their campus master planning.
Are there more questions from participants? If there are, take a minute and type them in the chat box.
Or can they just go on unmute and talk to us?
I think that would work too.
While that's happening, I can just jump in and answer. There was a few people that asked questions about the link with the CSA Canadian Standard for Student Wellbeing, Psychological Safety, and Charter. And I'll just back up and echo what Paula is saying around the Charter is really a North Star. I mean, it gives us the common language and framework for what we mean by health motion on campuses. We didn't have that before, so it's enormously helpful in just framing things out and giving principles. And many groups like the CSA Standard, but others like Workplace Wellbeing Standards are now referencing it. In a very practical way, what we did at UBC was use, when we created our strategic framework, we used the Charter to frame the how and the imperative, but then we built on that what UBC would commit to do. And the critical piece here is to get some accountability built in, so that there's specific measures and targets and indicators that we've collectively decided on that will track progress. So I think that's the next evolution, is pointing to the Charter, but making sure it informs these related documents.
Matt, I'm going to answer a couple questions here from the chat.
Yep.
I think I'm getting an echo again, too, so sorry about that. Community health organizers are students who serve in the very traditional public health organizer role. They are part of the backbone. They are involved with our community engagement. They are working specifically with registered student organizations, treating them as participating organizations, helping them to align their activities both internally and to maybe collaborate externally around some shared work towards our campus culture. The idea of the Canadian survey, I don't know how you get a hold of that. I think it's probably available. We'll talk to Matt more about it. That's who I talked to get it, was Matt. Matt helped me find that survey. Mistakes that we've made along the way. You know, we're so new to this that we pretty much make a mistake every week. The mistakes we've made are data, making sure that we have vetted the release of data. I upset one of my colleagues in fraternity and sorority and Greek life. We were so excited about some numbers we had, and we started talking about the risk factors and the protective factors of being Greek on campus and not being Greek on campus. And while we disaggregate data a lot, and that's an important thing to do, but the problem was we hadn't disaggregated it enough because there are so many types of different Greek organizations that some of our data was more about what was happening in the honorific organizations and not so much in the social organizations. So data is a very easy place, and how it gets used and who gets it and who vets it and who sees it first. How do you keep the schools? We have 23 different schools not publishing the school. I published data about the law school, which upset the law school. They should have been upset, but they could have been upset in private. So data is a good place to make mistakes. I think the rush to go back to programming. Everybody is like, well, you guys are really good at organizing things. Here, how about if you organize this thingy, this event, this, I won't name names, but anyway, it's like, yeah, we're really good at organizing, but that's not our job, is to deliver an event or deliver a program. That's a tough one. So, and somebody asked about funding. Right now, my funding is coming from the student health fee, and I think it's the best use of their $10 in that fee that in the 30 years that I've been here, they're getting more for that. The students are getting more for that money, spending this money this way than when I was buying condoms and teaching mindfulness. So, not that those things still happen. People, our res halls are the ones who buy condoms, and our clinic-wise condoms. And our Office for Religious Life took over a lot of the meditation stuff. So anyway, those things still happen, but it's now getting funded directly out of the student health fee.
I can jump in and answer a couple questions that just came in for me. So around funding, UBC when we formally adopted the Okanagan Charter, our executive and president gave us $1 million annually ongoing to drive this work. So it is really critical that you do have that conversation and say, if we're driving the charter, it has to be central to the university's mandate and be supported. It doesn't need funding initially to have the conversations and engage the community, but as you make this a higher priority thing, it is important that you get some resourcing. So we have had some wonderful leadership support, and you know, it's actually fairly easy to make the value case in terms of all the benefits you get for student learning outcomes and workplace outcomes. In terms of what is working well and not working well on campuses around the world around the Charter, I think one of the key things is those that are able to get a whole university approach, and go check out the Healthy Universities UK site for some great information on what that actually means. You know, those campuses benefit when you're able to get get senior leadership buy-in from multiple portfolios. But that's also one of the challenges. A lot of campuses have some champions, often within student health services, but they're struggling to get up in front of executive or leadership. So the idea of a formal sign-on to a charter was actually a mechanism for you to bring the charter forward to senior leadership and have that conversation. And at almost every campus where I see that conversation happen, they're met with support. So I can't underline enough the benefits of that. And one of the practical things we did here was we had a half-day session for our senior leaders, all of our deans, our execs, and others, to just talk about how could we all take ownership of driving this work forward. And it was remarkable to see the level of support there. And then I answered the question around the Canadian indicators by pasting a link into the chat box there. Okay, I'll hand it back over to my colleagues while I skim through other questions. I can quickly answer the question around how do we develop our strategic framework. We actually, on our website, have a document that talks about the engagement process we use. So you're welcome to look at that and reach out to me. But again, it was one of the key things was not creating too much new. We were actually building off as many existing targets as we could, existing commitments within HR, students, campus planning. And those are the targets we pointed to that say from a health and well-being lens, those are ones that we see as priorities that we can help amplify, and then here are some actions that we can develop. So that was one of our success factors.
This is Paula. As a resource, it's not up yet, but there will be a collective here in the next week. So some more about the strategic process. It's an interesting thing watching an institution look around and go, oh, what really is important to us? And well-being keeps coming up in a way that resonates with so many people, and people want to know, what can we do? What can I do? And keeping that energy going of it's not about more of this or more of that. In many ways, although it can be, in many ways it's are we conscious that when we plan campus that one of the best stress management tools is to have a bench to sit down under a tree with a really good visual perspective and your brain can reset. And that kind of keeping people out of a programmatic mindset but more into the systems of what systems are we creating on campus is really, really very important. So, in grants, somebody asked about grants. At this point in time, I have not seen any grants. I will say that it's really wonderful to begin to work with sustainability colleagues, because this idea that humans are going to be healthy on a planet that's not healthy is kind of a funny idea. But I have not seen any grants of yet. I'm going to turn it back. We are very close to 11 o'clock. I'm going to turn it back over to Pearlie if she's there. Or
yes,
maybe
folks,
Matt.
I am here.
You want to close us out?
Absolutely. I just want to thank you all so much for speaking on the webinar and apologize for the technical difficulties with the mic.
Perlin, you seem to have cut out, but I think that's a wrap. So thank you, everyone. I enjoyed being here and look forward to chatting with everyone in future.
Thank you. Bye-bye.
Sorry, everyone. I kept getting booted off. I was meaning to say thank you so much for presenting, and thank you, everyone, for being in attendance today. We kept having technical difficulties, unfortunately, as I kept getting booted out, and we have some echo problems. But hopefully, the webinar recording is going to be up as well as the slides on the website, and that should be going out to everyone tomorrow. Thank you once again to our presenters for their time and their efforts. And as I end this meeting, a pop-up survey is going to pop up, and that's just a little short evaluation for the webinar, if you don't mind. Thank you again, everyone.